Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's top headlines. As dengue starts to sting again in Delhi, 184 high-risk areas under focus. With the number of dengue cases slowly rising, officials have identified 184 areas where the possibility of mosquito breeding and the spread of vector-borne disease is high. The state government, along with Municipal Corporation of Delhi and New Delhi Municipal Council, has launched a campaign on checking mosquito breeding, strengthening health facilities, and roping in school children, departmental officials, and resident welfare associations to create an awareness about how the disease spreads and ways to prevent this. According to officials, a comprehensive exercise based on dengue cases reported from different parts of the city in the last few years and door-to-door exercise conducted by the local bodies to identify the locations prone to waterlogging and stagnation were conducted to determine what were the high-risk areas. No medical negligence in treating Hirschsprung disease, yet High Court orders state to pay Rs 5 lakh compensation. The Madurai bench of Madras High Court recently directed the state for paying Rs 5 lakh compensation to family of a boy who died during treatment at Government Rajaji Hospital in Madurai. Although the bench comprising of Justice R. Vijay Kumar noted that there was no medical negligence on the part of the doctors who had treated the patient, the compensation was awarded by the court as it took note of the fact that the patient had been treated at the GMC for 4 years, therefore fastening the state government liable with the payment of compensation. The High Court bench awarded the family of minor boy with Rs 5 lakh compensation and directed the state to pay the amount within 12 weeks. The history of the case goes back to 2012 when the minor boy was undergoing treatment at the GMC after he had been diagnosed with Hirschsprung disease. It is a condition that affects the large intestine and results in problems with passing stool. Although the plea had alleged medical negligence against the doctors of the GMC, after pursuing the documents and records, the High Court bench concluded that there was no medical negligence on part of the treating doctors. However, considering the fact that the boy had received treatment at JRH from August 2008 to April 2012, the judge observed that the state should be held liable. Therefore, the bench directed the state for paying of compensation of Rs 5 lakh to the petitioner within 12 weeks. Doctors moved to Supreme Court over cancellation of AIIMS INI CAT counselling. Upset with the cancellation of further rounds of INI CAT PG medical counselling in the institutes of national importance, the doctors have now approached the Supreme Court seeking relief. Referring to the notice issued by the AIIMS New Delhi on 19th of September, the doctors under the umbrella of Federation of All India Medical Association have also written to the AIIMS director and pointed out more than 50% vacant seats in multiple departments of various institutes. Clarifying that no further round of seat allocation should be conducted for INI CAT July 2022 session, the notice mentioned clearly that in continuation of the schedule of online seat allocation and order of the Honorable Supreme Court of India, in miscellaneous, no further round of seat allocation for INI CAT July 2022 session will be conducted. However, this decision came as a huge shock for the residents who were eager to join the institutes of national importance. Referring to this, a recent press release by FAIMA Doctor Association stated, "This sudden decision has come as a shock to the residents of the INIs who have been eagerly waiting for new residents to join the departments to replace the residents who have passed out of the departments in last 6 months." Amid confusion on NMC fee order, PG medical education in Maharashtra gets costlier. While there is no clarity regarding the implementation of NMC fee order for 50% private medical college seats, the PG medical education in Maharashtra has become costlier this year after several deemed to be medical institutes hiked their annual fees for certain courses. Fees have been increased by as much as Rs 10 lakh annual for certain courses. With this, the PG medical aspirants wishing to pursue their course in MD Radio Diagnosis or Dermatology at MGM Medical College will have to pay Rs 35 lakh per annum. The fees for these courses at MGM Medical College was earlier Rs 25 lakhs. Not only MGMMC, PG medical seats have become costlier in several other institutes including Jawaharlal Nehru Medical College, Wardha Bharati Vidyapeeth and Pune-based D.Y. Patil Medical College. Therefore, the students are now in dilemma to pursue their dream courses at the private medical institutes in the state while paying as much as Rs 1.5 crore. Although earlier this year, the NMC had issued an office memorandum and directed to implement government fees for 50% private medical college seats. The order has been challenged before several courts in India. Torrent Pharma to buy Crocio Healthcare for Rs 2,000 crores. Torrent Pharmaceuticals Limited has entered into a definitive agreement in acquire 100% of Crocio Healthcare Private Limited for Rs 2,000 crores. The consideration includes Rs 115 crores of cash and cash equivalents in the acquired business, indicating an enterprise value of Rs 1,885 crores. Curocio's portfolio consists of leading brands such as Teddy Bar, Autoglass, Po, B4 Nappy and Permite. The top 10 brands of Curocio account for 75% of total revenue. With this acquisition, Torrent Pharma will add a field force of 600 MRs and a distribution network of 900 stockists. Commenting on the acquisition, Aman Mehta, director, said that we are delighted to enter into this deal with Crocio. The acquisition offers Torrent the opportunity to enhance the presence in dermatology with a differentiated portfolio and is a strong strategic fit. Crocio has built a commendable set of high market share brands in cosmetic and pediatric dermatology that we look forward to adding to our product offerings. That's all from the health world today. Now we have Isra Zaman to update us about happenings in the medical world.
I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Ban of menthol cigarettes helps smokers to quit, reaffirmed by a new study. A new study concludes that the 2020 European ban on menthol cigarettes made it more likely that menthol smokers would quit smoking, supporting previous Canadian research on the positive public health impact of banning menthol cigarettes. The research team surveyed a national sample of adult smokers of menthol and non-menthol cigarettes in the Netherlands before and after the EU menthol ban. Of the menthol smokers surveyed before and after the ban, 26.1% had quit smoking. This quit rate was higher than the control group of non-menthol smokers, of whom only 14.1% had quit. In fact, the increased quit rate of 12% of menthol smokers after the European ban is greater than the increased quit rate of 7.3% found in an ITC study of the menthol ban that was in effect across Canada in 2018. For decades, tobacco companies have added menthol to cigarettes because it creates a cooling sensation that reduces the harshness of smoke. It makes it easier to start smoking, causing non-smoking youth to be more likely to progress to regular smoking and become addicted to nicotine. For more than a decade, the WHO and many other public health authorities have called on governments to ban menthol in cigarettes to reduce smoking. On April 28, 2022, the US FDA announced a proposed rule to ban menthol in cigarettes and cigars. This Dutch study also found that 1/3 of menthol smokers reported continuing to smoke menthol cigarettes even after the ban. The tobacco industry markets a wide range of accessories to enable people to add menthol flavoring to tobacco products themselves. Obese individuals can benefit by weight loss. Intentionally losing weight can bring long-term health benefits for individuals with obesity, regardless of the method or strategy they use, according to a study of almost 2 lakh people. Those who lost more than 4.5 kgs had less weight gain and a lower risk of type 2 diabetes than those who did not lose weight, but lean individuals did not benefit with weight loss attempts associated with longer-term weight gain and higher risks of type 2 diabetes. Obesity can lead to higher risks of diseases including type 2 diabetes. Controlling weight can be an effective strategy for preventing and managing obesity and related diseases, though long-term weight change and risk of developing type 2 diabetes are not well studied. The US-based researchers included healthy participants from 3 prospective cohort studies from 1988 to 2017. Individuals were aged between 24 to 78 and predominantly female. 11.6% male and 14.2% male in the cohorts. 24 years later, risk of diabetes was reduced for individuals with obesity irrespective of weight loss strategy, ranging from a 21% reduction for exercise to a 13% reduction for diet pills. For overweight individuals, the researchers saw a range of 9% reduction in type 2 diabetes risk for exercise to an increase of 42% risk for those who took pills. And in lean individuals, all weight loss was associated with an increased risk of type type 2 diabetes, ranging from a 9% increase for exercise and a 54% increase for pills. The authors concluded that while weight loss can be beneficial for those who are overweight and obese, weight loss strategies do not bring the same gains for lean individuals, and weight loss strategies should be used only by those who medically need them. Immunotherapy before targeted therapy significantly improves advanced melanoma survival. A clinical trial led by clinicians at Georgetown Lombardi Comprehensive Cancer Center showed a remarkable 20% advantage in the 2-year overall survival rate for people with advanced melanoma who first received immunotherapy versus those who initially got targeted therapies. Progression-free survival, where the cancer is stable or improving, was also trending in favor of those who started on immunotherapy. The multi-center phase 3 trial DREAM-SEC was led by oncology professor Michael Atkins. The DREAM-SEC trial found that for patients with melanoma that have a mutation in the BRAF gene, specifically a BRAF V600 mutation, immunotherapy is the better initial approach than giving drugs that specifically target this mutated pathway. Starting in 2015, 265 trial participants with metastatic melanoma were randomly assigned to 2 groups. One group received a targeted drug combination, that is dabrafenib and trametinib, followed by an immunotherapy combination, ipilimumab and nivolumab, if their cancer resisted the first combination, and the other group received the immunotherapy combination first and the targeted therapy if necessary. Trial was stopped early due to the clear evidence of the benefit of giving immunotherapy first. According to the National Cancer Institute, there will be an estimated 9,780 new cases diagnosed and 7,650 deaths due to melanoma in 2022. A steep drop in melanoma deaths from 2015 to 2019 of about 4% per year is largely attributable to advances in treatment. Weights-based exercise is linked to lower risk of death. Regularly exercising with weights is linked to a lower risk of death from any cause, with the exception of cancer, finds research carried out on older adults and published online in the British Journal of Sports Medicine, and ensuring that a weekly exercise routine includes both weights and aerobic activities seems to have an additive effect, the findings suggested. All adults are also recommended to incorporate activities that work all the major muscle groups. Yet, while aerobic exercise is consistently associated with a lower risk of death, it's not clear if working out with weights might have similar effects. In a bid to plug this knowledge gap, the researchers set to evaluate separately and jointly the potential impact of exercising with weights and aerobic activities on the risk of death among older adults. They drew on participants from the prostate, lung, colorectal and ovarian, that is PLCO cancer screening trial. In 2006, more than 1 lakh of the participants were additionally asked if they had exercised with weights over the past year, and if so, how often they had done so. Anything from less than once a month to several times a week. Nearly 23% of respondents reported some weightlifting activity. 16% said they exercised with weights regularly between 1 to 6 times a week. Nearly 32% were sufficiently aerobically active, either meeting or exceeding the guidelines on moderate to vigorous physical activity or MVPA. Exercising with weights and aerobic MVPA were both independently associated with a lower risk of death from any cause, as well as from cardiovascular disease, but not from cancer. Overall, working out with weights in the absence of MVPA was associated with a 9 to 22% lower risk of death, depending on the amount. For example, using weights once or twice a week was associated with a 14% lower risk. Similarly, among those who didn't exercise with weights, aerobic MVPA was associated with a 24 to 34% lower risk of death from any cause, compared to those who reported neither MVPA nor exercising with weights. But the lower risk of death was seen among those who said they did both types of physical activity. That's all from the medical world. Now we have Dr. Nandita Mohan, who will be providing us medical journal updates.
Hello and welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan and I am going to discuss about a recent study that was published in the Indian Heart Journal that actually talks about high mortality rate in the state of Kerala. Now, the reason attributed is majorly due to cardiovascular diseases. Now, Kerala has an estimated population of over 3 crores as per the consensus that was conducted in 2011. The state experiences very high cardiovascular mortality and also a higher prevalence of hypertension and diabetes mellitus. So, to confirm this finding, the researchers conducted a prescription-based study in primary and secondary care hospitals in Kerala, including both public as well as private institutions. One practitioner was selected from each of the institution and data was collected using a structured questionnaire. Totally close to around 4,600 prescriptions were included for analysis. For hypertension-only patients, control levels were around 31.5% and was found to be significantly higher in public hospitals. Among the patients with diabetes only, diabetes control was seen in 36.6%. Now, when both the conditions were present, control was achieved in only about 17%. Therefore, the study conducted in Kerala did show that a majority of hypertensive patients did not have controlled blood pressure levels, particularly if diabetes coexisted with it. Hence, the researchers concluded that this has serious implications as Kerala is the state with the highest burden of hypertension in India. A recent study published in the Indian Heart Journal with the title Short-Term Outcomes with Dual Chamber versus Single Chamber Pacing for Atrioventricular Block, a crossover trial. Now, we all know that complete heart block occurs when the electrical signal can't actually pass normally through the atria or to the ventricles. Now, if the atrioventricular node is damaged during surgery, a complete heart block may result. Sometimes complete heart block even occurs spontaneously without any surgery. Patients with complete heart blocks are usually treated with either a single chamber or a dual chamber pacemaker. The lack of a significant long-term benefit with dual chamber pacemakers may be because the ventricular dyssynchrony with the right ventricular pacing outweighs the benefits of the atrioventricular synchrony. About 70 to 85% of the devices implanted are usually the dual chamber that is most commonly practiced in the Western countries. The study that I'm talking about was designed to evaluate the difference in the functional capacity between the two modes in the short term in patients with the AV block. A total of 42 patients were studied for primary outcomes of quality of life and the 6-minute walking distance between the dual sensor ventricular demand rate responsive and the dual chamber pacing modes. At the end of 2 months after the device implantation, randomization was done and the device was programmed to dual sensor ventricular demand rate responsive or the dual chamber pacing modes. The researchers between these two found no difference in the functional capacity as well as the quality of life between the two pacing modes. None of the patients even developed pacemaker syndrome and there was no preference of any of the specific modes. So in patients with complete heart block, there was no difference in the quality of life as well as the functional capacity in the short term when programmed to either a dual sensor ventricular demand rate responsive or a dual chamber pacing modes. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.